Derita, derita, derita. Stop, stop, stop. Okay, okay. Up, 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 up. Don't move. Asparagus.
Hey guys, what's up? This is Stephanie. Welcome back to my channel. So in the video today, I wanted to discuss my first OSCE experience. If anything, this is more like a story, like storytelling. So for those of you who are about to start your clinical year and are about to have your OSCE, hopefully this video is helpful for you guys. So what is an OSCE? So an OSCE is a type of examination that you get in PA school. Medical schools have it also. Nursing students also have them also. And it's a type of exam where your professors or your school is able to identify and they are able to grade you on how you are with patients. Basically, how do you obtain your histories, your past medical history, your review systems, your social history? How are your skills with the patient, your patient skills? Are you warm? Are you comforting? Are you rude and standoffish? Also, how are your physical exam skills? Are you able to do an appropriate abdominal exam? Are you able to do an appropriate pulmonary exam? Are you doing the special signs on your physical exams? Like if a patient's coming in with appendicitis, do you check for your Rothstein sign, right? Do you check for the McBurney's point, your obturator sign, etc.? For musculoskeletal, are you doing all the special exams? Like if they have an ACL tear, are you doing, for example, the Lockman's test, etc.? So they get to examine you on how you are with patients. And so now, OSCEs tend to differ depending on what program you apply to. For example, my program has an OSCE for every rotation, and the OSCE is going to be depending on what the rotation is. So if it's OB-GYN, you might get something like a pelvic exam, so they'll test you on how to do a pelvic exam. Usually for the pelvic exam, of course, you have to describe what you're doing. So you're going to say, for example, I'm going to palpate the woman's inner thigh. I'm going to inform her I'm going to insert the speculum, etc. So you're describing everything that you're doing there. And then they grade you on whether you're doing it in appropriate steps, are you performing the bimanual exam correctly, etc. And also, like, you might get like a breast exam for your OB-GYN OSCE. And other OSCE that I had was for psychiatry. For psychiatry, OSCE is completely different for all the other ones because you have to ask more questions, and it's more like on the questions that you ask and on the specific questions that you're going to ask. So for the patient that's presenting with suicide, you want to make sure that you ask all the pertinent questions to see if they are safe to be sent home, or do they need to be hospitalized? Are they harm to themselves or to others? So those type of OSCEs are more different. And then also if I had a OSCE on surgery, like topics that I would get asked on in surgical procedures or surgical emergencies, like your cholecystitis, your appendicitis, etc. ER, I got like a DVT for ER. They can also give you something like, they really like to do MSK, like your ankle injury, etc. So they test you on your physical exams, and of course they also test you on how you are going to, so you've done the physical exam, and then what tests are you going to order for this patient? If it's a DVT, do you want to do an ultrasound? If so, why are you doing the ultrasound? Are you going to do, do you want to do, if you think it's a pulmonary embolism, do you want to do a CT angiogram? Are you going to order a CBC? Are you going to order a D-dimer? Are you going to look at the fibrinogen level, etc.? If it's someone that's bleeding, are you going to do a PT or a PTT or an INR, etc.? So it's your workup also for the patient and explaining the reasons why you're doing certain tests that you're doing. So if it's an older male that's coming in with bleeding and they're on warfarin, like you would say, I want to do an INR for this patient just to see what their INR is. Or and the reason why I'm doing it is because I want to measure it and see, like, do I need to do something with the dose, etc. And then once you've talked about your diagnostics, like say if I suspected if it was a DVT, I told her I'm going to do a DVT, an ultrasound of the lower extremity. And then they tell you, okay, the ultrasound came back positive. What do you want to do? Or sometimes they'll show you a picture. If it's a patient that's coming in with a cough and they show you a chest x-ray, you're like, oh my gosh, this is pneumonia. So they're just going to show you a chest x-ray. And then you look at the chest x-ray and you're like, you know what, I'm going to do this. And depending, of course, on what you see on the chest x-ray, if you suspect this pneumonia, then for these patients, you're going to say, I'm going to do this antibiotic. For example, if you suspect atypical pneumonia, I'm going to send him home with the macrolide, like clarithromycin or something. And that's usually what they test you, is just like, how is your thinking? How's your physical exam? Like, how are you going to be as a future medical provider? And so for my first OSCE, when I took it, I definitely did not know what to expect. Of course, it was my first OSCE, and I was very nervous. I'm a very nervous individual. I suffer from panic attacks, generalized anxiety disorder. And so sometimes when I get very, very nervous, I forget information. And one of the things they also test you on your OSCEs is you want to make sure that you have a differential diagnosis of at least 3. That makes sense, right? If you have something that's coming in with urinary problems, like they're having like frequency urinating, you can possibly do your differential diagnosis of like a UTI, right? You can maybe even say, if it's a woman, like vaginitis or something, right? You're obviously not going to say something like a headache that has nothing to do with urinary symptoms, right? So that's another thing that they test you on, is your differential diagnosis. They usually want you to have 3 and explain the reasons why you're having each one. And so I was very nervous for that rotation. It was my ER, I had a DVT, and I bombed it. I didn't ask the correct questions. In a DVT, whenever you're doing your HPI, you want to make sure that you ask the woman your sheet, right? When we think about the mnemonic sheet, stasis. Do they have a history of having immobilization that's prolonged? Did they have a recent surgery? Not that they've been like a hip surgery where they have not been moving. Did they just get out of the hospital? Did they travel on a flight that was 14 hours to the other side of the world where they just did not move at all? And then that's stasis. H, hypercoagulability. Do they have a hypercoagulability disorder? Do they have someone in their family that has suffered from a DVT or died from a DVT or pulmonary embolism early? Do they have factor V Leiden, for example, right? That one's the most common cause of hypercoagulability. Do they have a history of pregnancy losses because of like factor V Leiden? So that's your hypercoagulability. And then your E is going to be just for some type of endothelial injury. So did they have any injury to the calf or anything? And of course, I didn't ask any of these questions. And these are some of the questions that you want to keep on your differential diagnosis when you are talking to your patients. And so that was one of the things that I did not ask. I definitely messed up. Also, during my physical exam, I did not measure the calves.
Oh my God! Wow!
Usually when you think about DVT, right, you want to measure the calf in comparison to the opposite calf. Is a lot more swollen or a lot less swollen. You also want to feel the temperature of the calf. Is it warmer than the other calf? You know, do you feel like, usually they say like a cord-like on your textbooks. I don't think I've ever felt that on a patient that has a DVT, but like make sure that you feel for abnormalities like that. Do your range of motion in the leg. You want to rule out maybe any type of ankle injury or anything like that. So I definitely messed up with my physical exam for that. And my differential diagnosis, I messed up with that. I said DVT, but then I started going off on things that were not even relevant to DVT. I don't remember what I said, but you know, you could have had different differential diagnosis for a DVT, and I didn't. And so definitely I missed a lot of things. When I talked to my professor, she gave me really good feedback and told me, no, I was just too nervous. And for those of you who are nervous, just make sure that you calm yourself down. And what I did after that, I definitely learned from that OSCE, and I made sure that I was not going to repeat that mistake again. And thankfully, after that one, I did well on the remainder of my OSCEs, except for my final OSCE, which I've discussed in another video. And thankfully, after that, though, I did do a lot better. I had significant improvement. And so what I learned from that is whenever I go inside the room, I just would ignore ignore the fact that my professor was in the room, and it made it a lot easier. Another advice I have for you, for those of you who have struggled with this, is that in clinic is how you're practicing with patients. So make sure you take the opportunity, and if your preceptor or physician or whoever you're with allows you to see patients, ask them, can I go see this patient? So you can practice those physical exam skills. because that's what you're doing, you're practicing them. And then of course, before I took my exam, I made sure I practiced on my classmates. Some of my classmates would practice with each other and just like role play, but I should have done a lot more than that. And so I learned that and made sure that I did that on the following OSCEs, and I did a lot better. If you don't have a classmate you can practice with, another thing that I did is that I practiced a lot in front of the mirror. So I would talk back and forth with myself, but if you can, it's really important that you have someone to practice on. I know some of my classmates practice on like teddy bears, like doing the auscultation and the percussion for the lungs and stuff like that. That's another thing that you can do also. So that is what I learned from my first OSCE, guys. Hopefully this video is helpful for you guys. So this is just, you know, what is an OSCE? I know a lot of the students in didactic year that are about to go into clinical year would get scared because they really don't know what an OSCE is, and that's what it is. They just examine you on your physical skills, your physical examination skills. How are you able to diagnose this patient, and like how do you deduct the information from the physical examination, the past medical history of the patient or the HPI or the chief complaint, and how do you work this patient up? And why are you ordering these certain tests? And what is your differential diagnosis and why? And what is your working diagnosis? Another thing they like to ask is, when are you going to follow up with this patient? So if it's a patient that has like new onset hypertension, right? For example, I don't want to jump straight into medications with this patient. Usually what I would do, for example, of course, unless it's an extreme case, but with this patient, what I would do is, you know what, I'm going to send you home. I'm going to send you home with a sheet where you can write down your blood pressures daily, and I want you to follow up with me in a week to see how your blood pressure is, because a lot of patients get your white coat hypertension, which is they get really nervous when they go to the doctor, so they present hypertensive. So that's why you want to make sure and see, is this hypertension, like, is it daily? And then when they come in the next time, then you're going to maybe possibly start them on medication. So that's another thing that they like to ask is, when are you going to follow up with this patient? So make sure that you know that also in your OSCEs. So hopefully this video was helpful for you guys. As always, if you have any comments or questions for me, make sure you comment below, and I'll talk to you later.